Welcome to the Weiser Center for Prostate Cancer, a sanctuary for hope where you and your family can thrive, from diagnosis through treatment, with patient-centered care from our team of experts and the wisdom of advocates and former patients.
There's a lot of fear along the way. My goal is to help reduce that fear, to give you guidance throughout the process. After treatment, at about 6 to 8 weeks, we do an assessment. Advanced practice providers do a physical, they assess the side effects, any kind of medical issues, and measure the PSA. And then there is a sex therapist who does a psychosexual assessment. We determine how they're recovering physically, what kind of rehabilitation support they're going to need, and what kind of emotional support they're going to need. And that support can be anywhere from almost nothing at all if they're doing well, to occasional check-in to see whether they kind of on the appropriate timeline for recovery, to monitor it more closely. We are attending to them and to their individual needs. Our patients come to us from all different walks of life. We have single people, we have various sexual orientation, different race, age, background. Everybody comes with their own set of needs when they're coming in. We want them to have all of that, and sometimes that requires expert support, ongoing education, and reassurance. The needs of somebody who is in a marriage of 50 years is going to look very different from somebody who's a single, divorced man who is thinking, how am I going to get back into the dating world? You know, people will heal better also when they are feeling more relaxed, when they're not stressing, when they feel like they have somewhere to go to ask a question. And we're here for any situation. And hopefully you can feel comfortable opening up and sharing about that. And nobody's going to either rebuff them or not answer when they are calling. It doesn't only make the patients feel better, makes us feel better too. I like to work and structure my treatment with patients specifically to what those needs are, what those goals are. Success is when patients feel like they're beginning to get the quality of life that they want to have after cancer treatment back.
You're going to get a consistent, high-quality outcome. And that's only possible by the research and the quality improvement efforts that have been ongoing at Michigan Medicine and the Weiser Center for Prostate Cancer for years.
First, let me mention that sex therapists are certified by the American Association of Sexuality Educators, Counselors, and Therapists to provide expert care to people who experience sexual difficulties. Sex therapists are able to meet with the patient and the partner soon after surgery or radiation, were there any concerns before this whole cancer experience arose. Then discuss how prostate cancer and its treatment affected their relationship and their sexual relationship, and discuss strategies for recovering, a new way of sexual relating, a new way of finding sex pleasurable after treatment. The couple has to adjust, and the couple has to work on figuring out how to be sexual again in a way that is comfortable and reasonably unself-conscious, because people can be very self-conscious. I was interviewing a couple and they said to me, we have got to a point where we can be unself-conscious when we make love. It wasn't like they were not still dealing with some sexual problems, but they felt connected enough to not be distracted by thoughts and worries while they were trying to be intimate. Depending on the relationship, sometimes there's not good communication. I talk with couples that have been together 40 years and never talk about sex. We try to fill the gaps and come to a place of cohesion and understanding in the patient's recovery. The partners should be aware, though, there are certain ways in which the men have to do their own grieving and mourning on their own. When a man experiences erectile dysfunction, oftentimes partners will say, look, penetration is not that important to me. We can have sex other ways and I can still be satisfied, and don't worry. And that is certainly important, but the man grieves the loss of erectile function just as a part of his normal body experience. This is going to be a shock to the system, and it's not just about sex.
From a urinary function standpoint, we know from a number of research studies that the older that patients are when they undergo surgery, the longer the urinary incontinence is likely to persist. And another one is just kind of the bigger that patients are, the more weight that is on the urinary sphincter, the longer that urinary incontinence is going to persist. Now, long-term, meaning 6 months or greater, there is an incredibly high likelihood that any given patient is going to recover full urinary control. We can use these factors to help guide us about the rate that urinary control is going to recover.
One of the things that men feel very concerned about, and some partners also feel concerned about, is leakage during orgasm. This is a normal side effect of surgery, which tends to get better as incontinence resolves, even though it may take a little bit longer than getting bladder control. Urine is a normal body fluid, just like semen. It's nearly, if not completely, sterile. One can manage it by emptying the bladder before sexual activity. Sometimes people disguise it with a lubricant. It's not harmful. It's something that can be washed off, and that eventually it will disappear as an interference.
When people develop side effects related to the urinary symptom, there are a couple of medications that we use quite often. And we also use over-the-counter anti-inflammatory medications to calm down the bladder in the short term.
Radiation therapy can have many impacts on an individual patient's body. When men are undergoing radiation for prostate cancer, there are 3 common side effects that they may notice as treatment progresses. Those are urinary side effects, bowel side effects, and tiredness or fatigue. With all 3 of those side effects, those typically gradually progress over the course of treatment and are most noticeable at the end of treatment or even a week or 2 afterwards. From a urinary standpoint, we expect men to potentially develop a weaker urinary stream, to urinate more frequently, occasionally have some urinary urgency where men feel like they have to get to the bathroom faster than normal, and occasionally men will also have some burning or discomfort with urination. With regards to bowel movements, men may notice a change in consistency in bowel movements or have softer and more frequent bowel movements, and occasionally this will progress to the point of diarrhea. Men also will have some tiredness or fatigue associated with treatment. This typically is not a tiredness or fatigue that prevents men from doing what they want to do in the course of a day, but most men tell me by the end of treatment, by 4 or 5 in the evening, they feel like they are dragging more than normal. Long-term side effects are much less common with modern radiation therapy, but tend to be more serious if they do occur. The risk of long-term radiation damage to the bladder or rectum is quite low. The risk of developing painful bloody urination in the long term or painful bloody bowel movements in the long term from damage to those organs from radiation usually would not be expected to happen in more than 1 to 3 men out of 100, so an uncommon side effect. In the long term, radiation can also cause erectile dysfunction. This tends to be a gradual decline in erectile function for men who have good function going in over the course of years. The best predictor of men who will have good sexual function in the long term is men who have good sexual function before treatment. For some men who receive radiation therapy for prostate cancer, we will also recommend adding a course of an anti-testosterone hormone therapy with the radiation therapy. The duration of this hormone therapy varies based on the aggressiveness of an individual's prostate cancer, but typically may range somewhere in the ballpark from 6 months to 2 years. The reason that hormone therapy is given with radiation therapy and not surgery is that hormone therapy actually sensitizes prostate cancer to radiation and makes the radiation more effective. And this has been consistently demonstrated in very large clinical trials performed all over the world.
There are a couple 100,000 men diagnosed with prostate cancer every year in the US. The type of prostate cancer really ranges from the lowest possible risk, we call it, meaning risk of spread or risk of coming back, so lowest possible risk, to higher risk, more aggressive prostate cancer. And treatment decisions are really totally built around how risky that prostate cancer is. And so for patients with low risk prostate cancer, almost universally the standard recommendation is something called active surveillance. And so that's the idea that not every prostate cancer needs to be treated. And in fact, for guys with this type of prostate cancer, this low risk prostate cancer, the harms of treatment outweigh the benefit of treatment by a long shot.
It's important for patients and their partners to realize that grief is not just a one-track path.
Most men and their partners have really found that engaging in rehabilitation brings them back to themselves faster, better, and that they feel empowered by taking a role in getting better through their own activity.
There's going to be good days and bad days. Some days you're going to feel like you've got this, you're comfortable with the plan, and the next day you might feel afraid and shaken and question your future. These are all common feelings when it comes to grief and loss.
Each individual cancer and each individual situation is different. From the mentoring aspect, you can kind of bridge that gap and say, we've experienced this, or I've experienced this. This might help you. This might help you feel better. And just somebody there to ask questions to and be positive. The biggest aspect about cancer is you must be positive about your future and your health. And if you are positive, it's a tremendous help in healing you. They go out of their way to care for you. The doctor's expertise, which is fantastic, the treatment, but it's really the people here at the University of Michigan that I think makes the big difference. And don't look at the negative. And that's why when people ask me how I'm doing today, I always say I'm living the dream, because I actually am living the dream every day.